The race for a cure is on.
My body was aching, the fear of dying was there.
Tonight on Sky News Australia, we go all around the world.
The virus is spreading because it hides. It hides very effectively.
From tuberculosis to malaria, inside the labs, on the verge of a vaccine. Coronavirus, the race for a cure.
The world is at war. The casualties are mounting. Supplies are dwindling and public morale is low. The enemy is a virus that swept the globe, indiscriminately killing tens of thousands of people. Our scientists are our only hope. We need a vaccine to prevent thousands more from being infected and more powerful treatments to save those unfortunate enough to be afflicted with COVID-19. Thankfully, we have some of the smartest minds in the world on the front lines. Tonight, in this Sky News special report, we go inside the labs where this vitally important work is taking place. We speak to the scientists from around the world who are putting their lives at risk to save others, including the Australian in charge of a multi-billion-dollar company who tells Sky News a vaccine is likely to be ready much sooner than first thought. Experts also tell us how previous health crises are helping us in this current battle. They explore claims the virus leaked from a Chinese bioweapons lab and warn a more deadly pandemic may be on the horizon. In 2020, the world is once again at war, but all of humanity is allied. We are all in a race for a cure.
The UK and US suffer another deadly day as coronavirus fatalities surge.
Hospitals are facing a desperate shortage of medical supplies and equipment.
It's been on our screens for months now. Since the first cases in Wuhan in China, there's been near wall-to-wall coronavirus coverage.
These are the very latest details on the coronavirus. This is what you need to know.
Let's go through the latest numbers for you. And the number of cases around the country has risen above 6,000.
More than 1.3 million people infected around the world, and the coronavirus outbreak is still spreading.
Those lucky enough not to be infected may suffer from COVID-19 fatigue. But anyone who's felt the full force of this virus will tell you the danger is real. This is one vicious enemy.
But yes, the fear of dying was there. It's in your face.
Debbie Kilroy was travelling from the US back to Brisbane when she sensed something was not quite right. What started as a minor sore throat would turn into something far more serious.
I was really nauseous. That I think was the worst for me, the nauseousness. My body was aching, I had headaches, I had a really sore throat, I had all nasal congestion. And because I'm asthmatic, what I was more worried about is that it was going to move into my chest.
She and her colleague alerted the authorities and quarantined in an Airbnb together. Over 25 days, they rode the highs and the lows. Dancing helped stave off the border. But being away from your loved ones as a virus wreaks havoc inside you can test even the strongest patience.
Even when I was in the most deepest, darkest holes and being the most ill with it, I knew, well, I sort of knew, well, I believed that I would come out of that.
Thankfully, she did.
Oh my God, Yay! We've just got the news. We can go home to our families. Yay!
More than 6,000 Australians have been through similar ordeals. So many weren't as lucky as Debbie. This is the cause of the crisis, the enemy in this global war. SARS coronavirus 2, the virus which causes the disease COVID-19.
A common cold virus, but it has, if you like, a sting in the tail, which is this ability to cause pneumonia. It's likely that because it's spread from animals, it's able to infect humans directly, so what we call a zoonosis, but it stimulates a very strong response in the lungs in particular where the infection occurs. And that strong response effectively fills the lung with fluid, if you like, and it's that pneumonia which is causing people to die.
It's believed to have first transferred from a bat to a human at this so-called wet market in Wuhan in China. It took just a few weeks for it to spread all over the world. The virus transfers more easily between humans than the common cold. It lingers longer on surfaces and kills around 1% of those it infects, making it around 10 times more deadly than the seasonal flu.
Well, everything surprised me about this COVID-19 pandemic. Every prediction I've made, every assumption I've made has proven incorrect, and it certainly has gone further and farther than I ever expected it to.
The virus's incredible spread forced entire nations to shut down. A health crisis triggered an economic one. Billions of people have been told to stay inside. Our way of life has changed dramatically, while more than 82,000 lives have been lost. To have any hope of returning to some sort of normality and to protect populations, we need to eliminate COVID-19. This may be the man to do it. Dr. Peter Farrell is an MIT graduate, Harvard University staff member, Australian Entrepreneur of the Year, Order of Australia medal recipient, founder of a $37 billion valued medical company, and he may be on the cusp of solving a global crisis. Do you believe you have a cure for COVID-19?
That's what we believe.
And this could be the weapon we've been waiting for. Researchers at Arcturus Therapeutics have developed a so-called messenger RNA. Once it's injected into the bloodstream, it replicates and should kill COVID-19.
So you're producing lots and lots of antibodies, which prevents the disease from progressing.
Universities in Singapore and the US have teamed up with Arcturus. Singapore's government is all in. They've given Arcturus $10 million and promised to speed up approval processes. And they're planning to test it on humans in July, and all going well, it could be ready for public use by the end of the year.
Obviously, the vaccine is the cat's meow, and we believe we have a leg up on most of the other people that are working on this. So if this works, it'll be a game changer.
He's not the only Australian powering ahead in the race for a cure. The CSIRO's Geelong lab was the first outside of China to successfully develop a lab-grown version of the virus to enable pre-clinical studies on COVID-19. It usually takes 2 years to get to that stage. They did it in 8 weeks, and they've already started tests with 2 potential vaccines.
So you can imagine our staff have been working 24/7 since we obtained a sample of this virus.
Ferrets are the guinea pigs. Scientists have been giving 2 of them injections and nasal sprays.
Now, the reason we use the ferret particularly for respiratory viruses is that it actually shares a particular receptor on the respiratory cells that humans have. Now, the virus, the SARS virus, actually binds to this receptor. So if we can stop that virus binding to the ferret receptors in the respiratory system, there's a very good chance it'll work in humans.
The CSIRO's first phase of testing will take around 3 months. It may be ready for public use in a year and a half.
Generally, the sort of phase that we're at would usually take 1 to 2 years to get to, and we've done this in around about 8 weeks. So this is the speed that's going on at the moment.
Scientists at Melbourne's Peter Doherty Institute for Infection and Immunity were the first to map the immune responses of a COVID-19 patient, while a Monash University team has already stopped COVID-19 from developing, albeit in a test tube. They're working with ivermectin, something typically used to treat roundworms, head lice and scabies.
A single dose of the drug was able to prevent the virus from replicating.
It's been in use for 30 years, so it should be much faster to get it to human trials. Researchers from the universities of Queensland and Melbourne say they've also deactivated the virus in a test tube. They're using 2 medications, a treatment for malaria and one for HIV. 50 hospitals want to be involved with human tests, but they need around $750,000 the trials to go ahead.
So we know the safety of these drugs, so we don't have to trial them in guinea pigs or petri dishes. We can go straight and give them to patients. And in fact, there's been some experience in China and Singapore in which these drugs have been given with potentially successful outcomes.
The team is expected to make an announcement regarding their progress next week. Of course, Australians aren't the only ones in this race for a cure. At least 35 companies and institutions around the world are on the case. Boston-based biotech firm Moderna will start human trials within weeks. Johnson & Johnson is working on something similar. It's aiming to have batches available for emergency use in early 2021.
It's not business for us. We are also announcing today that we will do this on a non-profit basis because we want to work with other people in the society to stop this disease.
These are extraordinarily short timeframes. Typically, vaccine trials take around 18 months, and getting a vaccine from the lab to the shelves, 5 to 7 years.
I would love to go to a laboratory and spend a couple of years testing something. We don't have time.
We may not have to wait as long for a breakthrough in the treatment of COVID-19.
Treatment becomes especially important right now, the hunt for a treatment, because we're a long way off yet from a vaccine.
In Berlin, a microbiology lab is working on a version of a 100-year-old tuberculosis treatment which may be ready by the end of the year.
Hope is that we can at least reduce significantly the proportion of individuals who develop disease, and that hopefully the disease is also milder.
And Fujifilm's medical division just started the third phase of clinical trials of an influenza antiviral drug. President Trump has his money on a drug the experts are not so sure about. He wants the anti-malarial drug, hydroxychloroquine, to be distributed across the US.
Because I want people to live, and I'm seeing people dying. And I've seen people that are going to die without it.
Thousands of people already take hydroxychloroquine to treat lupus and rheumatoid arthritis. There's no medical consensus on whether it's effective against COVID-19. Its potential side effects include vision loss and heart problems.
I don't think there's anyone who doesn't hope that this or some other treatment proves safe or effective. But we don't have that now. We have four very, very tiny studies.
Australia's peak body on managing health emergencies says hydroxychloroquine should not be used to treat coronavirus. But the Department of Health said it may be given in a controlled environment in the treatment of severely ill patients in hospital.
What we do know is this: both drugs are incredibly safe. They're incredibly safe. The possibility of something going wrong with these drugs is almost nil.
Several clinical trials are underway. 1,500 people are being tested in a project in Minnesota. But in a pandemic, there are few ideas too controversial or crazy to consider. French researchers think sandworms could hold the solution. The insect's blood stores oxygen for up to 6 hours. It could help human COVID-19 sufferers who are struggling to breathe. Tests on 10 patients have begun.
It's a moment we have to think fast. It's a moment where we have to think out of the box.
It is indeed a time for out-of-the-box thinking. It's also wise to search for lessons from the past. Possible solutions to this current crisis may be found by examining previous epidemics. Ebola ravaged Western Africa 5 years ago. More than 11,000 people were killed by the virus. It was so resilient that the bodies, clothes and personal items belonging to the victims had to be destroyed by fire.
So immediately the corps will have to respond to take this body to care for cremation.
Like COVID-19, patient 0 was believed to have contracted the Ebola virus from a bat. Despite Ebola being first identified in the 1970s, there is still no cure. A vaccine was rolled out just last year. Extreme quarantine measures and a public health campaign encouraging basic hygiene were credited with ending the outbreak in 2016. Professor Piot helped discover Ebola.
Oh, this is much, much worse than Ebola. Ebola requires very close contact for transmission. People are very scared of it, but frankly, it is usually very contained. I mean, we have some exceptions, but it's because it's a respiratory transmitted virus. That makes it so worrisome, and it's very infectious because there's so much virus in the throat. So this is literally something you can catch by just talking to somebody.
Malaria, a mosquito-borne disease which kills more than 1 million people each year, has effectively been eliminated in most Western nations. It required significant changes in infrastructure, destroying mosquito breeding grounds, improving drainage systems, and making insecticides more readily available. COVID-19 bears a more striking similarity to SARS. It's 82% identical. The sudden, acute respiratory syndrome outbreak of 2003 killed 813 people. It too is believed to have transferred to a human from a bat in China. Those infected had similar symptoms, and it spread almost as freely. By promptly isolating those with symptoms, monitoring affected populations thoroughly, and strictly enforcing quarantines, SARS was effectively eradicated.
So when SARS happened, the epidemic it became extinguished fairly quickly. But in the case of COVID-19, we've seen global spread. And I think that really relates to, even in the last 15 years since the SARS pandemic, the rapidly increasing degree of global connectedness and the increasing difficulties now faced in pandemic response.
Containing SARS's cousin, COVID-19, is much more difficult, but still possible. Statistician Kim Sawyer says we just have to chase it down.
We're finding this virus, we're finding it too late. The virus is finding us. We've got to find the virus. As a consequence, we have to mass test. We have to find the virus, we simply have to mass test. And the problem at the present time is we don't have the resources to do that mass testing.
By testing everyone in areas coronavirus has infiltrated, authorities will identify all the virus carriers, including those who aren't showing symptoms. The Italian town of Vo tested all residents, isolated the carriers and stopped the spread.
Basically, they sampled the virus out of the town. Now, the problem we have is we don't have 3,000 people, we've got 25 million. We have to try to sample the population.
While some have argued we should encourage the spread, that rather than enforcing lockdowns, people should be allowed to move freely, get the virus and get on with it.
I think it's just overkill in countries that are shutting down. And in fact, if you look at Iceland, Taiwan, South Korea, and even in Singapore, who were early in the game doing something about it, and Germany, I mean, the death rates are around that 1%, and in the older people with concomitant disease, chronic disease. So I just think we're just getting really overly cautious, and it's hysteria more than I'd call it a media-demic rather than a pandemic.
How do you explain that view to the nearly 100,000 people who have died worldwide? How do you explain that view to their families? And that is surely a number that would have been a lot higher had this self-isolation not been in effect.
There's no question that that's accurate. I'm not trying to be unsympathetic. I'm just saying that the reality is that people die, lots and lots of people die from heart disease, cancer, and so forth. And this is another unfortunate way to die. and doing nothing is an option. Sweden took that option. There'll be more deaths caused by the economic problems than from the virus itself. That's my view.
As we wait for breakthroughs from labs around the world, basic hygiene is currently our best weapon.
It's like back to the times of the Spanish flu, 100 years ago, where that killed, 50 million people. However, we have antibiotics that can treat pneumonia. There are respirators. We are better equipped.
While we're not certain who the COVID-19 patient zero is, the consensus is it came from a Wuhan exotic animal market. Yet some politicians, media outlets and members of the public claim there's a more sinister origin, that COVID-19 leaked from a Chinese bioweapons lab.
Just a few miles away from that food market is China's only biosafety level 4 super laboratory that researches human infectious diseases. Now, we don't have evidence that this disease originated there, but because of China's duplicity and dishonesty from the beginning, we need to at least ask the question.
Opinion I have can be summed up in one word: baloney. There is a lab that does research into biological issues in Wuhan. Nobody I've talked to at the Pentagon believes that it has any link to this virus.
While there may be no concrete proof to support these theories, the coronavirus crisis highlights serious security concerns.
China has a biological weapons program. The US State Department a number of years ago said as much. And it's clear that they have the scientific capability to be able to do this at an extremely advanced way.
The US has spent $78 billion on biodefense since the year 2000. Pentagon reports expressed concern around possible Chinese attacks disrupting food supplies.
The senior leadership in the US military is more frightened of biological warfare than any other threat. There have been a number of sci-fi movies over the years about super rust that kills all the world's wheat, this sort of thing, and is targeted against particular types. That really worries people at the Pentagon because it's also very difficult to counter, and it's very difficult to tell if you're under attack or not.
COVID-19's killed thousands, shut down cities and ravaged economies. A deliberate attack using a more deadly bioweapon could be catastrophic.
I'm absolutely sure that military organisations will be looking at this. They'll be carefully looking at the damage that is happening to military organisations themselves, having to lock down with military people with coronavirus. And they will be thinking, military planners will be thinking to themselves, wow, this would be a great way to distract states if we were getting ready to attack them.
So much has changed in the space of a few months. You only have to take a look outside to see. That's what happens when millions of people are forced indoors. But there is a concern that we may have to go through all of this once again, because it's highly likely, at least for the younger generations, that there will be another pandemic. And once we beat COVID-19, the next one could be even more deadly.
We're very likely to see another pandemic in the not too distant future, and these global pandemics will continue to occur more frequently than they have in the past.
COVID-19 is the latest in a long line of modern pandemics. Ebola, SARS, MERS and swine flu, the most recent. AIDS and the Spanish flu are among the most deadly. The mass movement of people is typically responsible for a minor, exotic sickness becoming a global health emergency. And travel, of course, is becoming much more common. Last year, airlines sold more than 4.5 billion seats. And other trends have some experts concerned.
The unsustainable way that we live, the encroachment of human communities into wilderness areas and the environment, creating many more opportunities for exchange of pathogens between wild animals and the human population. The live animal trade in China is another unsustainable and dangerous activity that will result in more pandemics in the future if it's not properly managed.
Educating the public is key to preventing another health crisis. That was a difficult task in the days of the Spanish flu, when Australian authorities only managed to put up a few hundred posters. Nowadays, there are all manner of ways to alert the public and encourage good health practices. From TikTok hand-washing tutorials to Twitter posts from the Terminator teaching us how to flatten the curve.
Public gatherings, restaurants and all those gymnasiums out the window. You stay home.
And all governments must be prepared for another emergency on a similar scale.
Having ventilators in storage, having large stockpiles of masks, having large amounts of protective equipment, all those basic things that allow doctors and all those who work with them to operate safely and efficiently.
In many ways, this pandemic will bring home to politicians, governments, the general community, the need for investing in proper pandemic preparedness and pandemic response.
The response to the coronavirus pandemic is unparalleled. Some of the world's smartest minds using high-tech tools, trying new and novel techniques, and learning from lessons from the past. These men and women are carrying the weight of the world's expectations on their shoulders. A breakthrough in these labs could save hundreds of thousands of lives. Whoever cracks the code, whichever lab creates a safe and effective vaccine, could be considered the winner in the race for a cure. Never has there been so many barracking for anyone to cross the line.